Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our oral info bite video today on tinnitus. Now, we need to give you the answer from last week's question as well before we get into this. So, we asked in last week's video, perforated eardrum will be classed as what type of hearing loss? And the answer is A, a conductive hearing loss. So we picked 3 people from YouTube who got this right, which was Bert Buns, Hilary Foote and Sarah Kerr, so well done to you guys. And 3 people from Facebook who was Jenna Lamond, John Wode and Gretchen Rockefeller, so well done to you guys as well. Gold star from Mr. B. So we're going to be covering tinnitus today in this video. Now this is a huge topic, okay? So what I'm going to do, I'm going to condense this down and give you some of the highlights, some of the pointers. If you want a little bit more information about tinnitus, I really strongly suggest you go and check out the British Tinnitus Association's website, or you can even go onto something called Take On Tinnitus, which is a little module that the Tinnitus Association's put together. Both are fantastic resources and I use them a lot in practice. I'll put a link into the description below for those two. So the first thing we're going to answer is, what is tinnitus? Well, tinnitus, the medical definition of tinnitus is when we perceive a sound when there's no external sound. So a sound that only we can hear in our heads, okay? Now this could affect one ear, it could affect both ears. You can get it centrally in your head, you can get it just outside your head, it can be ringing, rushing, all sorts of different things, okay? Now, tinnitus is not a disease, it's not an illness, okay? It's just a process that happens within our brain when we just get a little glitch in the system sometimes, okay? But as far as tinnitus is concerned, it's very, very common. It affects about 30% of the population at some point in their life. Now, in most people, you get the tinnitus will be short-lived, so just for a few minutes and then will disappear. That's perfectly normal, that's okay. What we're going to be talking about today is persistent tinnitus. So tinnitus that goes on for a long period or long term, all right? So we know kind of what tinnitus is, but why do we get it? So before we can answer why, we need to understand what normally happens to the sound when the nerve impulse leaves the cochlea and travels up the auditory nerve to the brain. Now we've covered in the last couple of videos what the cochlea and the hair cells do by picking the sound up and converting it to a nerve impulse. Now the cochlea is always firing tiny little impulses up to the brain all the time. So our brain has a recognition and filtration segment, okay? And what happens there is when these signals travel up the auditory nerve, they're processed. And during that process, we then decide whether we recognize the sound and whether we need to be made consciously aware of the sound. If not, the sound gets filtered and we never become aware of it. But if we do become aware of it, then we also assign an emotional response to that sound, okay? Right, the easiest way to describe this, I want you to imagine that you've heard your favorite song, okay? So your favorite song comes on, and what happens then is the nerve impulse travels up to the brain, hits this recognition and filtration part. Your brain recognizes this as your favorite song, so it makes you consciously aware of it. So now you can hear the song and you get an emotional response to it. Well, it's your favorite song. You're going to feel happy. It's going to make you feel relaxed. It's a really positive response to this music and this song, okay? Now, what happens with tinnitus is that they get a bit of a glitch in that filtration mechanism, okay? So what happens then is we become consciously aware of these tiny little firings coming up from the ear to the brain. Now, because it's coming from the ear, the brain only knows how to interpret those signals as a sound. So we become consciously aware of a sound that wasn't there before. Now, we can't identify where this sound has come from. We don't know why it started. So the emotional response that we get in persistent tinnitus is that it makes us feel anxious, okay? Now our autonomic nervous system is the one that's in charge of the fight or flight response. Now if it starts to make you feel anxious, the autonomic nervous system then tells the filtration part of your brain, I think we need to focus on this a little bit more because it's making me feel a bit anxious and we want to make sure we stay safe. So what happens then is you start to become more consciously aware of the sound. And because you're now more consciously aware of the sound, it makes you feel more anxious, which then drives this fight or flight response, which makes this feedback go back to your filtration system to say we need to be more aware of it. And you can see how this cycle starts to come to effect. So you become more aware, it makes you feel anxious, which in turn then makes you become more aware, which makes you more anxious. You can see how this will follow. So that's how persistent tinnitus comes to be, okay? Now, when we talk about why do we get tinnitus, what's the cause of tinnitus? Nobody really knows the specific cause of tinnitus, but we do know there are some factors that make it more likely to experience tinnitus. So these factors would be having an untreated hearing loss, having any kind of blockage in your ear, stress, or exposure to loud noise. All of those things are associated with tinnitus, all right? Now, what do we do if we suddenly start to experience some tinnitus? Now, this is really important. If you start to experience some tinnitus, your first point of call, and it's persistent, it's going on for more than a couple of days, your first point of call would always be your GP. So your doctor then will take a look in your ears and look for anything medically that may be causing the tinnitus. So we talked about having a blocked up ear. It may be that you have an ear infection, you may be blocked up with wax, and your doctor can advise you on getting treatment for that, and then you should find your tinnitus will disappear once that treatment's happened. If your doctor looks in your ear though and discovers that there's no obvious signs from the outer part of the ear, where do we go then? Well, the doctor would then normally refer you to either an ear, nose and throat consultant or a specialist audiologist or hearing therapist to discuss your tinnitus and to have some hearing testing done. Now, hearing loss and tinnitus a lot of the time go hand in hand, okay, especially untreated hearing loss. So if we identified there was a hearing issue there with that patient, then what we would suggest is trying some hearing aids. Because if you imagine when things are very quiet and you suffer with tinnitus, you're far more aware of that tinnitus sound. So if we can boost the hearing up, make you hear better, so that your ears are always being stimulated by all the little sounds around you, then you're less likely to focus on your tinnitus and you're more likely to habituate. Now, when we talk about habituation, what we mean by that is where we become less focused on our tinnitus, which then in turn has a more positive effect on the tinnitus. So we may see a reduction in the tinnitus. Now that can happen over a long period of time and everybody's different. So your tinnitus is always different from person to person and the amount of time it takes you to habituate is different from person to person, okay? So we've established what we would do if somebody had a hearing loss, but what happens if you don't have a hearing loss? Well, some people can spontaneously develop tinnitus, okay? And they might not be able to find a cause for it. Well, how do we treat those patients? How do those patients manage their tinnitus more effectively? Well, there are certain things that we can do which helps us to manage our tinnitus. Now, there are links between how relaxed we feel, how much sleep we get, how much we focus on our tinnitus. All these things have an effect on tinnitus, whether that be a positive effect or a negative effect, okay? So the first thing I want to talk to you about is relaxation. We talked a minute ago about this cycle that happens when we feel anxious. It feeds into our tinnitus, which then makes us more aware of our tinnitus, which makes us feel more anxious. Now imagine if we could break that cycle, or in best case scenario, start driving that cycle in the opposite direction. The more relaxed we feel, the less we're going to focus on our tinnitus. So if we do anything that relaxes us, that might be some relaxation exercises, or it may just be getting out there and doing something you enjoy. Now, this is what we find a lot of the time is patients are, they don't want to do the things they enjoy because they're afraid it's going to aggravate their tinnitus. Whereas really what you need to be doing is getting out there, doing the things you love, doing the things you enjoy, because it's going to make you feel relaxed. It's going to distract you. It's going to take the focus off your tinnitus, which is going to have a positive effect, and it's going to help you to habituate, okay? Now, another big factor is sleep, all right? Now, the more tired we feel, the more lethargic we feel, our concentration is not as good, then that can also make us more aware, make us focus a little bit more on our tinnitus, all right? So getting a good night's sleep and getting good sleep is really, really important. Now, some people, if you suffer with tinnitus, find that going to sleep can be a little bit problematic because you tend to go to sleep in a quieter environment, and that's when people would normally notice their tinnitus a little bit more. So this is where something called sound enrichment comes in. So when we use sound enrichment, what we're doing is basically we're playing a sound which is set at a slightly lower volume or intensity than our tinnitus, so it gives us something else to focus on. So what we would find then is that we can listen to that sound and it takes the focus off the tinnitus sound. Now, a lot of people use sound enrichment. They use things like nature sounds, so the sound of the seashore, or babbling brooks, or crickets, or all sorts of different sounds. But basically, it's any kind of sound that doesn't take a lot of concentration to listen to. Now, a lot of people will play this. They might have what they call a little portable speaker next to their bed, and they play sound through there. Or the other thing you can do, if you find that it's disturbing maybe your partner at night, you can get something called a pillow speaker, which is a pillow with a little speaker set in the middle of it, which you can connect to a little audio player, and you can play the sound and only you can hear it. It's a great way of getting yourself off to sleep and relaxing you before you go to bed so you get good sleep. Now, the other thing you can do, or people find really helpful, is to talk about their tinnitus. Now, this doesn't suit everybody, and when I say talk about the tinnitus, I don't necessarily mean going along to support groups and things like that, but talking to a professional such as a specialist audiologist or a hearing therapist can be really helpful for some people. Talking to your family and friends about tinnitus can be really good. Or if you don't like the idea of a tinnitus support group, there are lots of online groups that you can join, and you can, especially at the moment with COVID, you can have a chat to other people, because some people do find it really helpful to talk to somebody who also has tinnitus to get their experiences as well. So you can see there are lots of different things that you can try to help to manage your tinnitus more effectively. Now, I have given you a very general brief overview of this, but if you want more information, I really can't stress enough how good the Take On Tinnitus website of the British Tinnitus Association is. I'm going to put a link into the description below. Have a good look at that. We use this a lot in our practice to help our patients understand their tinnitus and to look for ways they can manage it more effectively. So I really strongly suggest you go and have a look at that one. Right then, guys, I hope you managed to follow that. It was a very in-depth topic, and I'm sorry if I lost you halfway through there, but what we're going to do now is we're going to go through the question for next week, okay? So whoever gets this right in the comment section below, we'll pick 3 people at random and you'll get a shout out in next week's video and a gold star from Mr. B. So your question for this week's video is, which of these is a cause of tinnitus? Is it A, hearing loss, B, stress, C, noise, or D, all of the above? Okay, so is it A, hearing loss, B, stress, C, noise, or D, all of the above? Post your answer into the comment section below. We'll pick 3 people at random from YouTube, 3 from Facebook, put it into next week's video so you get a shout out from Mr. B. As always, guys, take care of yourselves, take care of one another, and I shall see you for next week's video.